because I'm trying to protect you from catching cases. It is illegal to refuse to float. It is literally against the law. You will lose your license fucking with that one. It's illegal to refuse to float. I wrote it in letter C.
So when you say, we run on here saying bipolar/schizo, would that be anything psych or specifically bipolar?
No, it's bipolar and schizo, because if it's OCD, you can do it. If it's depression, you can do it. But bipolar and schizo can be pretty dangerous if you don't know how to deal with that. Did you have your hand up, baby? Okay, so there you go. Now, I already did the bottom when it came to avoid calling the doctor. Didn't we talk about that? This ain't no damn doctor's test. It's a nursing test. Show what you know. Don't be trying to turf the shit to a damn doctor. That's going to be a problem for you. So I told you the average amount of times your little punk ass ought to be calling the doctor is one time, right? Okay, now absolutes. We talked about that. Only, all, never, none, always, never choose them. Now let me tell you some other stuff on letter B. I need you to quit tying people up. You, my love, are not in an S&M movie. Stop tying people up, please. In other words, your last resort is restraints. Just think about your own damn self. You ain't trying to want to be tied up yourself. Well, you might be because you're kinky. But I'm saying, in a hospital setting, your punk ass don't need to be tying people up. Now, I'm going to tell you how much you can get in trouble with this one. We had two situations. One of them was an aide. She ran in here afterwards, after she got fired, told me what happened. I was like, mind blown. Her situation was the RN got the order to do a tuberculin skin test on one of their residents. This was in a long-term care facility. She goes to get the resident this TB test. The resident said, hell to the double no. I ain't doing that. So she was like, well, the doctor ordered it. So she rounds up 4 aides, one of which is in my class. She gets these aides to hold down this man and gives him a TB test. And it wasn't that damn long ago. Not only did every aide get fired, she got written up and sent to the board of nursing. She will never do that again. Next patient, even worse, more innocent. Could have happened to any of us. Patient is trying to pull out their trach. This nurse puts some wrist restraints on them. She goes out of the room on her way to go ahead and call the doctor for that order. I said your ass need to be tying up people. She goes and sees the guy in the next room crawling over the rail, trying to fall out of bed. You know, typical life be life. She go in there to take care of that business. By the time she get done in there, hospice done already walked into this patient's room, sees them tied up, and hits the roof and writes her up. Because there was no order. Let me tell you how I look at it. You can pull your trach, your Foley, and your NG out. I don't give a fuck. I ain't losing my license for you and your craziness. I'm not. So I'm not going to tie you without an order. I'm going to get the order first. Go ahead on, pull all your shit out. I got to get my order first. Be safe, nurses. Be safe. It's not a good look that you didn't get an order to restrain a patient. Now, you have exceptions, don't you, y'all? If they're going to hurt you or hurt themselves really ridiculously, you got to just do it, right? And everybody understands that, but you're about to be charting a whole book on that one, okay? And then when you tie these people up, let me remind you what's on this test in real life. And real life sucks because it's a lot of work. How often do you have to chart on these patients when you tie them up? Woo! Every 15 minutes. Make sure you know that on this test. Every 15 minutes. Every 15 minutes you're writing some shit. That's on your test. Okay, you see the heating pads? I need y'all to stop burning your damn patients, okay? Quit it. Just cut it out. Listen to me, beloved. Heating pads is not the same as warm compresses. Do not make them equal. Warm compresses is allowed on the test. Heating pads ain't never allowed on the test. Y'all with me? They really shouldn't even be doing that. But on the test, you can't do those. Yeah, hospitals be having them, but you ain't supposed to ever have them. And I have seen the patient burn with those, especially diabetics. Yeah, I don't even fuck with them. I just remember they not allowed. Okay, so warm compresses are better. And a good example of when warm compresses really do help you, if you got a patient with sickle cell and they're already taking, you know, maybe a PCA pump or different meds, the warm compresses make them feel so much better. They go in the axillary area, the groin area, their back. It just feels so much better for them. Okay, so that's a good one. Okay, now look at here. If you put the pillow under the patient's knees, you are going to cause this. Now, if you don't spell it right, instead of, and what is this another name for? If you don't spell it right, because you don't look at what I wrote on this here board, instead of foot drop, you're going to have coochie drop on your on your paper. Because it looks a lot like perineal, doesn't it? But it's not. It's peroneal. Peroneal injury is foot drop. If you put pillows on the patient's knees instead of under ankles, you're going to cause foot drop. And that's a permanent damage. So be careful. Now, you see the next word? What is it? What are you avoiding next? Stop rubbing on people. Go rub your man, your woman, whatever. Stop rubbing on these damn patients. Now, I say that because on the test, massaging anything ain't never the answer. Because normally it's something you shouldn't be massaging. Okay, so stop rubbing on folk. Now the next one says what? Fluid restriction. Why did you think you need to steal everybody's water? What the fuck was wrong with you? That you took water pictures from everybody. Stop it. Who is the only people we need to restrict their fluid? I'll make it simple for you. I'm gonna make it simple for you. Any organ failure. Watch this. Here we go. What organ is this? The heart. Congestive heart failure. What organ is this? Kidneys. Chronic kidney disease. What organ is this? Liver. All three of those organs fail. You can restrict water. So you can restrict water for anybody on CHF that has CHF, anybody with CKD, anybody with cirrhosis. Y'all all right? Okay, now here's another one that's not an organ failure, but is always on your test. SIADH is endocrine, isn't it, beloved? That's a hard disease. I told you before, endocrine is very difficult. Syndrome of inappropriate antidiuretic hormones, mouthful of garbage, right? So that's another one that you can restrict their fluids for. Stop throwing people on bed rest. Hell, you want them to get a clot? What the hell? Now, there's only a couple people that qualify for bed rest. That includes preeclampsia patients on magnesium sulfate. So that kind of matters that you know that. So preeclampsia, I'm going to write that down. Bed rest is preeclampsia on magnesium sulfate. Magnesium makes you feel like a wet noodle, so you ain't getting out of bed with that. Or that aortic aneurysm patient. Aortic aneurysm patient. Okay. Now, we talked about this already. I'm not going to belabor it. Another one says avoid meds for chronic conditions. Say what? For chronic conditions, use basic care and comfort. Okay. All right. And of course, select all we talked about yesterday. Now, you take that psych meds packet out because you knew we was going there. You almost time for your little lunch. Stop growling at me. Stop your damn growling, people. Now, please write on the top of this 75% of all meds. Write that on the top. 75% of all meds on this test. That's what you write on the top. The number one psych med on your test is this one. Psych meds. Okay. This is number one. Now, you got a lot to know. This medication, what does it treat? Diagnosis is bipolar. Okay, so you got to know it like that. This medication treats bipolar. Now, that's the diagnosis, and I like what the little baby said. You kind of want to know what part of the bipolar does it treat, because remember, y'all, that bipolar is two conditions. What two conditions is bipolar, everyone?
Depression and mania.
Depression and mania. It is two different disorders. Bipolar is depression, severe depression, and mania. So you either real high or you're in your lows. This medication targets the real highs or the mania, like the baby said. Okay? Now, you got to make sure you know a few things. Weight gain is the number one side effect. Weight gain is the number one side effect. And this is the only time you can have a high sodium diet. Woohoo! This is the only time you can have a high sodium diet, or at least moderate. In other words, a low sodium diet is dangerous for this patient. That's what I want you to take up out of here. A low sodium diet is dangerous for this patient. When you look at lithium, I want you to remember the toxicity. Many of you were taught that lithium is toxic at 2. I want you to forget you were ever taught that shit. Because your test got something for you, and it ain't no damn 2. Look at what I wrote. I personally wrote it for you. It says 0.8 to 1.5 is therapeutic. Y'all see that? So in your case, toxicity is literally greater than 1.5. What is on the test? 1.8. Yup. But if you were taught that 2 garbage, you're going to miss that one. This drug is only available as PO. There's no IV. You would question that order. There's no IM. The category for this drug is mood stabilizer. Mood stabilizer. It is a lifetime medication. Once you're on it for life. They need to take it the same time every day with food. Don't crush it, chew it, or break it. and no caffeine or alcohol. Now, you probably know yourself that your punk ass got a psych problem. You don't need alcohol any damn way. Because what is alcohol, everyone?
Depressant.
It's a depressant. It's a depressant. Your highest priority with this drug, everyone, is push fluids. Now, that's cute, but what the fuck does that mean? If I say push fluids, that sounds real, real cute. But your test got something special for you, baby. They want to know what the fuck does that mean. So, I asked the question. For all of you little angel doves in this class, where's, let me find one. I always see one in here somewhere. Hand me your water bottle, little girl. Give me that bottle. Okay, children. We say push fluids. This is a very typical water bottle for your patients. Typical. So when you have certain conditions like this one, or gout, or whatever, in which the order is talking about push fluids, you have to talk in a way that your patients understand. Because they sure as hell ain't gonna understand 3 liters. They don't know what the fuck that is. So I'm going to ask you to tell me if I'm pushing. No, actually, I'm going to get to normal first and then abnormal. If I'm doing normal fluid intake, I'm a healthy person, ain't got none of this shit on the board, nothing what we talking about now. We just very healthy people. How many of these should I drink a day? You first. How many, brother? Hey, don't look at that. What the fuck? You cheating. How many?
About 8 to 12.
How many?
6 to 8.
How many? Stop giving me these ranges, y'all. Men ain't right. What you got?
10.
8.
8. 5.
You said 5. What did you say?
10. 12. 3. 4. 6. 8.
No range.
Okay. 6.
3.
8.
Are you looking at me? 16.
Now, most of y'all crazy ass, deadly fucking nurses gave the patient a deadly condition called SIADH, water intoxication. Y'all killed the motherfuckers. This is why we go over this shit, because you don't know normal. Now, this bottle right here is 500 milliliters. If this is 500 milliliters and the average, the normal intake of fluid is 2 liters, how many of them do you need? 4. And only a few of you said something even close to that. Everybody else killed the patient. 16, 12, 10, 8. The fuck? Y'all killing people. Too much. Water intoxication. Jesus help us. Pray for them, Jesus. Okay, so here we go. Now let's switch up the game, beautiful. Now we got an order to push fluids. When we push fluids, this 2 needs to be a 3. And this then becomes, instead of 4 bottled waters a day, and even 3 to 4 bottled waters, which is fine. Now we got to do 6. Does that help a little bit? Put things in perspective. So you tell your patient like this, because your patient, they're older, they're lay persons. You say, you know the big cases of water they sell in the grocery store? Do you buy those? 99 times out of 100, they do. You say you need to look at the little bottles that they have in there, not the really little ones, but the normal sized bottles. You're going to need to make sure you kill 6 of those in a day. Now, if they were on a fluid restriction, it's only 2. Make sure you know everything I just said. Because that's what? How many liters? How many is 2? 1. 1 liter. Very nice. Okay. These are things you wish you understood before you start talking to real people. Right, y'all? Because you done told 92-year-old Betsy to do 10 damn bottles. Jesus help.
Okay, so Michelle, you sure it's not 16?
Your ass is on some drugs, child. You drink 16 a day.